pleased to welcome you to the Ending Deaths from Despair webinar series. To our knowledge, it's the only one of its kind in the nation. On behalf of the Ending Deaths from Despair Task Force, I would like to thank you for joining us and for being part of the solution. The goal of this webinar series is to save lives in Dane County, help set a standard for communities around the nation grappling with deaths from despair, help us understand what underlies these deaths from despair, and to provide the tools to all workers who are trying to prevent these deaths. We are also here to lay the groundwork for continued conversations and action on how to make Dane County's mental health and substance use disorder treatment accessible, culturally competent, and effective to eliminate all deaths from despair. Today's presentation of the series is entitled Overdose Spike Alerts, Responding to Increasing Overdoses, presented by Masami Glines from Public Health Madison, Dane County. Masami Glines has been working in overdose prevention and harm reduction for 3 years. She didn't know much about drug use when she started, but she had knowledge on community mental health care systems in Dane County and understood why the whole person approach is important in substance use and other behavioral health issues. She is a restorative justice peacemaker for the Dane County Restorative Court. For drug overdose issues, she has been working on daily data analyses, issuing spike alerts for community awareness, and compiling overdose trends and evidence on new challenges such as THC gummies and xylazine for community education. Masami was planning to present with Julia Olson, who also works with public health, and Julia's information will also be shared in this presentation if folks have questions. But today it will just be Masami presenting, and we'll get to questions at the end. Finally, my name is Leah Rolando. I'll be our moderator today. I work as the project coordinator for the Ending Deaths from Despair Task Force at Safe Communities, Madison, Dane County. I support the task force work by co-chairing our Zero Suicide Collaborative, providing assistance to schools implementing peer-to-peer suicide and substance use prevention, wellness and harm reduction programming, and convening other suicide and substance use prevention stakeholders in the community. And with that, I can turn it over to Masami.
Thank you very much for the good introduction, and thank you very much for the Ending Deaths by Despair Task Force to have this opportunity for us to talk about Overdose Spike Alert today. Before I start, protecting people from overdose and most importantly from fatality is the important health issue. That's how we approach, and it's our honor to be able to talk about this work that the local health department is doing day to day. So first, I would like to talk about what is overdose spike alert, and then secondly, how is it issued, or how do we determine there is a spike, and then most importantly, third point is to how we try to save people's lives and respect people with dignity and respect to people who use drugs. So before we start, I would like to talk what we do. As Leah said, we are a local health department in Dane County and Madison, city of Madison, combined together. And our team is Substance Use Prevention Harm Reduction Team within Policy Planning and Evaluation Division. There are 5 divisions within the department. But our team's mission is to treat people with dignity and respect, reduce harmful effects of drug use, and prevent death. And the most important thing we have to remember when we talk about numbers and people who use drugs, these are the people who have rich life, loved and loving people. And this heart shape is made by all the words describing those people who are lost by family members and friends. And, they are greatly missed, and we would like to have less deaths in the community, and that's how we work together every day together with partners to have less unfortunate incidents. Just a little graphic these our offices. We may be familiar with City County Building, which is in downtown Madison. But we have syringe service programs where people can come and get supplies of syringes, new syringes, so people don't share syringes to get infections such as hepatitis C or HIV. And those services are done in the upper right side atrium, which is on South Park Street near South Transfer Point of Madison Metrobus. And lower left, East Washington office. This is 2700 level East Washington Avenue corridor above the Folsom Public Library. We have this office, and both places have ample parking, so it would be easier for people to access. And South Madison office was used for COVID testing and vaccination. So right now it's not, it's in transition, but for syringe services and also getting Narcan and fentanyl test strips and harm reduction smoking supplies, people can come to the Atrium building or East Washington office. And I'll share the information on the website that people can look into what our services are more later. So yeah, we have these offices. Well, when we talk about spike alerts, I look at data. We have to have something to base our spike alert messaging. So I would like to talk about data. But keep in mind that, as I said, these are all just not just numbers, but real people who lived very full and complicated lives. And they are our families, friends, neighbors, co-workers, or ourselves. And these quotes are from Fatality Review, so focusing more on people who lost their lives. But even for people who are alive and using drugs, this applies too. I'd like to emphasize that again. And here's the data. So over 21 years or so, I'm showing the data from 2000 until this 149 on the upper right is 2021's data of overdose fatality, and specifically from opioid-involved overdose deaths in Dane County. So as you can see, numbers are going up, and I don't have exact number from last year, but we are expecting that about the same as 150-ish people, unfortunately. And as people viewing this webinar may know, opioid use is an epidemic in the nation. It's a big issue, so that's something we have to work for to decrease the fatality and give people a chance to get into treatment and or where they want to be, help them to be where they want to be in their life. This is another data series. Pay attention to the left side data, which is divided by race. And Black people have 3.3 times more rate of dying from opioid overdose compared to white counterpart. And this is all population adjusted, so it's showing how much rate of people dying per 100,000 residents. So adjusted, so 3.3 times more people dying when you're Black person. That's something we keep into our heart in daily work. There's such huge discrepancy in outcome of drug use. And middle one, we compared gender, and female has less than male, 1.7 times more for men. And age-wise, on the right side, most people who use drugs and die from drug use is 25 to 54. Yeah, predominantly. So our target population is younger, working age people. But we know that there are other groups of population that use drugs. So we try our best to accommodate all the needs and more focus on highly prevalent population. But these are just information for you to know. So let's focus on overdose spike alert, today's topic. This is a logo we use. We want it to be visually remembered well by people. We can use words, but also visual and color can trigger memory from people. So we wanted to stick to these color coordinations and spike alert, so that whenever people see something like this, they will notice, oh yeah, spike alert. So what is spike alert? You may have some ideas, but it's a warning system that we would like to use for people to know, just like tornado warning. Something threatening is coming your way. Be careful, watch out. And it has to be timely. We don't want to use like weather forecast data from yesterday to say, oh, there was a tornado threat yesterday. It's too late. So just like that, we want to have timely data to share. That's why I check data for overdose daily, so we can issue something quickly before it reaches to people, hopefully. And then important thing is to communicate the message to people. If it doesn't reach to people, it doesn't make any work. It doesn't work. So we pay attention to communication, and also then people have to know what to do. We got alert, but what? We have to tell people what's good to do to protect their lives and having overdose incidents. Not fun to go through overdose, traumatic, so try to avoid as much as we can. And the overall goal for the program is to prevent fatalities and also traumatic events, overdose, avoiding overdose as much as possible. Sorry, I didn't have time to put that. Avoid overdose, but that's what our goals are. So that's how we issue spike alert. Our goals to issue spike alert, but how do we do that? People often want to know, how do we decide if there's a spike in the community that people have to pay attention to? So our team looked at historical data for Dane County and came up with baseline data for numbers that seems to go, we seem to see on daily basis that might be like happening every day. Unfortunately, I wouldn't say like there's zero overdose in Dane County. There are some overdoses in Dane County. That's the reality. But we have we have some baseline data that we can build upon our conversations about overdose, more overdose or less overdose happening. And those numbers come from two systems or three systems, I should say. First, EMS, Dane County EMS data, emergency management data. So the emergency management is a dispatch center that sends emergency medical technicians, in other words, ambulances, whenever people call for help. And the technicians look at what's going on, and if there's any drug-related issues observed, they make that note. So then all the compiled data comes to me. And hospital emergency room also have to report their patients' conditions, and they are places that they put in like things like overdose from drug use or prescription drugs. So I get that data coming to me, and they are queried. So not everything about hospital data. I don't get like injury data, but anything related to drug use come to me. So I go through that every day. And I also have to read some narratives from the whoever writing the report, because there's more details, like something like it seems like this person used cocaine, or this person is having this prescription medication that may affect, for example, like blood thinner. If someone's taking blood thinner, then more likely to cause like fainting episodes, which might be almost similar from outside to have opioid overdose. So I read all the narratives to determine what might be drug-related overdose. And I eliminate some intentional drug use too. Unfortunately, some people intentionally use some drugs, prescription and not prescribed, both, to harm themselves. That's something this group is interested, but right now I try to focus on accidental overdose by opioid use. So that's what I pay attention, but I also mark these other interesting and important instances for other purposes. So we pay attention to what's going on in the community. And I also, by reading narratives, I pay attention to patterns, like common drugs that might be causing overdoses. Then there might be some drug dealers who bring that kind of potent drug to the County community, or there might be geographic pattern that one dealer might be distributing in the neighborhood, or any clue that I can get from reading. I try to pay attention, and if there's any unfortunate fatalities happening, that could mean the supply has very high potent drugs. So I pay attention to that too. And that data sometimes doesn't come through EMS and hospital data. If someone's already deceased for a long time, the police department may just handle that kind of case. So as I said, there's third data source potentially is police department data. I have to look at that sometimes, or I should say daily. I subscribe to chiefs. Madison Police Department has chief's blog, so I look at that too. So these are the data sources that we use to decide if there's a threat of drug overdose that may happen to people if we don't do anything. So how we decide maybe this time we should warn people to protect themselves. So then once we decide to spike overdose spike alert, how do we do it? This is communication part that we touched upon before. So we have agency partners like LIA's Safe Communities and other, such as treatment providers or recovery coaches. We have lots of partners who may encounter with people who use drugs. So we try to tell them that we are issuing spike alerts because we see more cases than usual. And we also have this image of green buttons on the phone showing here, but we developed text message or email message coming to your phone or computer when we issue spike alert. So people are welcome to subscribe to this system. And I know most agencies tend to use email messages because they're at work computers often, but more individuals who use drugs or whose family members or friends use drugs want to be protective for them. They subscribe to text message more often. And we also release news release. Our communications team issue news release, so the media will pick up our news. And we also make posters to be posted in public spaces like a weight room or bathrooms in facilities. And so not everybody has cell phones or subscribe to our spike alerts. So we try to be visible as much as we can. And we also do direct outreach. As I mentioned, we have 2 civilian services program offices. So we as a team, civilian services team or harm reduction team, tell clients, we see more than usual numbers. We see more overdoses, unfortunately. So please be careful. Try to take this Narcan this time, or try to use fentanyl test strips, or do you have safety procedures for yourself if you have to use what's your body, or who's your body, or how do you use when you have to use by yourself, something like that. We try to ask these questions so that people know that they have to be safe. And this is these 2 things are posters that I mentioned. So these are posted in many places, and I attach these to the email message that goes to agencies and people who subscribe to our email alert system. So hopefully they print and post in public spaces. And the middle one is the screenshot of text message that we send out to people's phones. And the blue part is hyperlinked, so people press that and then it'll take you to our website that has more information on what to do. And we use QR code for ease of use. So these QR code scanning goes to take you to our website too. And usually the spike is good for about a week. Usually it goes down by then, like the supply who come to Dane County used up or something like that. And we don't want to be a background noise so people don't pay attention anymore. We don't want that. So we ask the partners to take this down in a week. And here's another example of our objective 3, how to tell people to be safe and protect themselves. We try to give this out to clients. So we print both sides of paper and cut in the middle vertically and fold into accordion shape so that this little piece of paper would fit in people's pocket. And little sturdy paper, and also the ink is protected because we print both sides all over the ink. So hope it can withstand a little accidental wash once or twice. And the left side has safety messages, or you can always use more later, go slow, don't hurry to use up what you got, and don't mix your drugs, especially dangerous to mix what we call downers. The alcohol and some drugs, especially opioid, make your breathing and mood slow down. So that feels good, but also dangerous to your body. So don't mix these downers because that could multiply the effect of slowing down everything, your body system. And always have Narcan on hand that can save your life. And on the right side, the top is our program information, and Behavioral Health Resource Center is the acronym for the BHRC is the acronym for Behavioral Health Resource Center. It's located near South Madison Metro Transfer Point 2, but they are open and good at getting phone calls, and they are open to give you therapist connection or treatment connections when you're ready. So anything related to behavioral health issues, they can also responsive to your call. And they have Spanish speaking people too. And this third one was useful, especially during COVID time when people have to isolate themselves. It's not a good thing to use by yourself because you cannot give Narcan to yourself when you're overdosing. And also, it's not good to use alone. We always encourage people to use with others, but if you ever need to use by yourself, this is the number to call, and people on the other line have lived experiences, and they ask where you're calling from, and if you ever get unresponsive on the phone, they'll send EMS people, ambulance people to you. And the last one is scanning to go to our website, and also the website page has a link to sign up for Spike Alert. So people who are watching, you can scan now, but also we have shortened URL. If you don't have means to scan, publichealthmdc.com/spike alerts. You can go to that website. And I've been talking about Narcan a lot. So the left side is a picture of Narcan nasal spray, which is very easy to use. Just open up, and it's like a allergy nasal spray. You shoot the plunger into someone. Put the tip into some overdosing person's nose and push the plunger. But we also try to encourage people to take fentanyl test strips, and this black and white is the instruction how to use fentanyl test strips. That's given out for free too, and depending on what drug you're using, the water amount of water you use is different, so we try to instruct that. And also important to know for people using fentanyl test strips, one line is positive It's opposite of COVID test, so don't get mixed up. We wish there's universal online is something instruction, but some a test has certain outcome and the other one has opposite outcome to tell people positive or negative. So you have to instruct both. That's what we give out to the fentanyl test strip. As you might know by now, fentanyl, very potent drug, opioid, synthetic opioid made in labs. So very easy to make for people who are trying to make money by selling fentanyl. Easy to make and it's potent. 100 times potent than morphine and 50 times more potent than heroin. So, and also there's analogs like sister or brother of fentanyl that's more potent than fentanyl itself. So all these things are in the market. So we encourage people to test your drugs. Unfortunately, this test doesn't say how much fentanyl is in your drug, but it tells if there's some or not. And you still have to use it with caution because there's some false negatives, but it's better than not knowing anything about your drug supply. So we encourage people to take. And all these safety messages and spike alerts generate social media traffic too. I know not everybody's eager to sign up with a local health department spike alert message system. We don't ask for names for these, but you still have to give your phone number or email address. So this is another good methods that people are using. Lots of social media conversations about overdose spike alert. These numbers are from February overdose spike alert, but more than 50,000 reach, which is like opening the message or tweeting, retweeting, or sharing, and 500 direct shares about our department's Facebook, Twitter page, 500 shares, and almost 4,000 people liked or commented or shared again. So very good in reaching people. And we just had to issue a spike alert last week, but similar number of shares on the social media. So I'm glad, and I hope some people took some precaution and safety measures by seeing these. And so what is spike alert? How we decide to issue a spike alert and what we want to convey to people, what things that people should know to protect themselves. I hope I covered, but we also want to share people or agencies who want to start similar kind of message system. Lessons learned or on our way to get this program running. It's always good to have strong relationship with EMS or emergency management people, because they are the one who knows the data and get the field notes of what the technicians are encountering and seeing and hearing. Well, especially in Wisconsin, we don't have what's called OD map, which is developed in East Coast using mapping system, but first responders can type in on the field and it's shared instantly with people who are involved in the overdose response. But unfortunately, Wisconsin doesn't have that, so it's good to have good relationship with your local EMS at this moment. And partners' voices are important. We always try to hear feedback from partners and try to tailor or change our message or how we do overdose spike alert business. So we meet what people want. That's most important. We have our goal, as I said, is to save people's lives and have less overdose incidents. So we welcome any feedback for that purpose or goal. And extra eyes and voices. It's one thing for someone like me to look at data every day and see if there's any pattern or more numbers. But what's more important is to listen to what people who come to our services are saying. For example, oh, I lost a friend, or I felt very weird this time, but after using something like that, all this information is important. And we try to pay attention to what people are saying because they are the first hand knowing what's going on, what's in the market. And always try to collaborate with public health safety people. As I said, I get data from Madison Police Department, and sometimes we hear from narcotics task force about what's coming to the Dane County area, or if there's any bad intention to bring big bag of something to try to sell and make money. Those information important for people's safety, people who use drugs, not try to people just want to use for their mental health and substance addiction needs, and we want to avoid as much harm as possible. So it's good to work with public safety because they have some information we may not get. And always advocate for stigma reduction and people's rights. But our public health Madison Dane County's mission is to see health rights about health is human rights. So we try to advocate substance use issue is one of the health issues. Systemic issue related to racism or discrimination and childhood experience, traumatic experiences or brain injury, all these things affect drug use. So we try to advocate for stigma reduction. That's my presentation. If you have any questions, my name is Masami. As I said, you can send me email or you can visit our department website, Public Health MDC. MDC is for Madison Dane County initials.com. And we have social media posts. It's very fun with lots of fun pictures. So please subscribe at Public Health MDC. Also, we have some periodic news release or blogs or newsletters quarterly, so you can subscribe to that too. So I talked about drug use and within policy planning evaluation team, but we also have like beach conditions. Now it's summer and people want to go to lake beaches and what's going on there. We share information about that, and mosquitoes are out. So all the health related news and information you can find. So please visit us. And this is the QR code, bigger QR code that you can scan to visit our My Program site. Thank you very much. And I take any questions.
Thank you so much, Masami.
Thank you.
That was a lot of information and super important information for people to hang on to in case they need it. At this point, we'll open it up to questions. We're still able to send those in, and I can share those with Masami. But to kick us off, we do have one. Do spike alerts really make a difference? So I know you've shared about the importance of awareness and letting people know what to look for. But do they really make a difference? I guess that might be kind of tricky to answer, but how would you respond?
So. Yeah, I hope so. And I wish I could visit the social media posts because people share or comment, but have been busy. We have less staff in the team, so I haven't had chance to visit social media posts too much, but I hear people looking at and sharing. Yeah, it was helpful to know there's spike going on, so I try to go slow or use less or make sure I have Narcan. I think, yeah, that's on the horizon for us to interview people who use drugs. Does it help? Did it help? We want to get more input or feedback from our clients, so we would know more definitely if it's helping or not. But I think it doesn't hurt. It doesn't have counter bad effect on people. I guess, I hope. It's always better to be prepared. So that's what I think, and make an error on the safer side. I would like to know if there's any counterproductive thing going on by us having overdose spike alert. I hope helpful.
Yeah,
I hope it answered.
yeah, thank you. It's hard when there's not a lot of data on the spike alerts yet, but I think it's important to start thinking about how we're evaluating and how people are using them. I know a ton of people are sharing them on social media, so it at minimum is creating awareness and sharing resources with people.
Yeah, and we have been not doing overdose fatality review, which involves like interviewing people who lost their loved ones, unfortunately. But that kind of effort may bring, if they encountered overdose spike alert, if it was effective or not. But if we, as I said, we can't keep doing that for a while. It'll start soon, hopefully. But that's one thing we can tap into to know overdose spike alert effect and reach. And it's a very sensitive topic, so it's not easy to ask. Did you, for example, we could ask, like, did you do anything differently because of the spike alert? But it's very sensitive. Sometimes the people are open to share their stories, but most of the time they just want to get stuff and leave. That's the reality. And people have busy lives. Lots of people come during lunchtime to get stuff. So we don't have enough time to engage in conversation.
Another question came in, what can I do to prevent an overdose? And I know you spoke to that, but is there anything more that you would share?
Yes, so I didn't share that aspect of our work, but if you are concerned about people who use drugs, their lives or their overdose incidents, first of all, it's good to have Narcan, so it can reverse overdose. But that means that that means that overdose already happened. So as I shared before, it's always good to use slowly if you're using, because you can tighter, or you can see how your body respond to what you're using by going slow. But if you use a lot of amount at once, then you may not have enough time to try and see. So we always recommend go slowly, especially when you change your supply source, get drugs from someone new. You may want to go slow because that person different source of drugs coming to them first. And yeah, and as I said, don't mix. And fentanyl, I talked about fentanyl, which is very potent. That is mixed in with many different drugs, including stimulants, which is not opioid, cocaine and methamphetamine. Fentanyl, which is opioid, is often mixed in these days. So it's always good to not to take too much amount, or not to mix with alcohol or the sedated drugs, and test for fentanyl by getting fentanyl test strips from us, or Vivint Health, or community pharmacy. These are the places that you can get fentanyl test strips for free.
I think that is, you're leading into the next question we had, about how to get Narcan, and then how do you get fentanyl test strips. So please come to our programs, but also Narcan and fentanyl test strips are distributed by the state DHS, the Department of Health Services. So if you go to their website, they have a map showing where you can get Narcan. I don't think there's a map for fentanyl test strips, but at least Narcan. And if you don't mind paying some money, pharmacies like Walgreens and CVS sells you without any prescription. Easier to get in Wisconsin. They don't ask why you're getting these. You can just get them. And also programs like us is listed as Narcan Direct participants, which means for consumers or for people in the community, Narcan Direct participants means you don't have to pay anything. It's already paid by the state or the federal programs. That's where you can get Narcan. And fentanyl test strips, as I said, it's a little less limited yet. It's okay to be used in the statewide, but if you want to get them free, contact us or Vivint Health. I think they don't charge anything. And community pharmacy on the east side of Madison on Fair Oaks Avenue. They are our partner satellite place, so they have our stuff, our products, so you can get fentanyl test strips for free. That's great. It's good that people have options. So I appreciate you sharing all those. Another question that came in, folks are wondering if the spike alert issued last week is still active. I don't remember what exact day that was issued.
It was based on Monday, mixed up. Monday and Tuesday data, and we issued on Wednesday, the 24th. And as I said, it's about a week. We ask people to be vigilant. So it's off, but it's always good to be careful. And as a person who checked data, it was still high a little bit until 2 days ago or so. Still, yeah, a little higher. So it's good to be careful. Not like, oh, it's not a spike alert anymore. Yeah, sorry, it's not like that. So I always encourage people to be careful. Yeah.
Thank you so much for that.
Thank you. Yeah, there's nothing from the side of people who use drugs. There's to protect. There's no big change how you do if you want to be safe. If there's spike out or not, but as I said, there's a bigger chance that potent drug supply is coming to Dane County. That might be the cause of the spike. So yeah, you want to be careful if you're getting from new dealer or new person, or if you're switching some drug or want to use more often somehow, something like that, then you want to be more careful especially during spike time.
Yeah, that makes sense. Great. Well, I don't see any other questions, so I think we can move into closing. Masami, thank you so much for everything you've shared, all of the resources that Public Health Madison Dane County offers, and then naming some of the partner agencies too that can offer Narcan and fentanyl test strips. If folks have questions, Masami shared her information in the presentation, so you should have access to that. And then we will let folks know about other activities coming up through the Ending Deaths from Despair Task Force. And please feel free to get in touch with either Public Health or Safe Communities, Dane County, if you have any other questions.
Please.